Welcome back to everyone. For those of you who also took off July, and we haven't seen you since the June meeting. Just as a review, June's program featured a webinar from the National Mended Hearts website on empowering patients to take control of heart failure. Hopefully, you also get our newsletter because it gave the URL to watch this webinar if you missed it, and reminds us that we learned what heart failure is, how it's measured, signs and symptoms, and how to monitor your condition including new devices that are available now to help. Today's webinar is also in answer to a member request. This one is how to help manage incontinence and comes from the Family Caregiver Alliance website. And we have with us Christina Irving, the Client Services Director, who also spoke with us in March about the resources available to all on their website and beyond. Thanks for joining us again, Christina.
Good to see you all.
All right. You know, I wish I had known half the information that's in this webinar 20 years ago when my powerhouse mother could have used it. We believed all the myths were true. She was so embarrassed, she stopped leaving the house and she stopped drinking enough water, which led to constipation, a urinary tract infection, and worse. This 36-minute presentation will help us take away the helplessness of this condition with doable procedures and up-to-date resources. It starts with an introduction of Nicole Davis, who is the speaker, by Leah Eskenazi. We will stop the video at the Q&A to either answer any of your questions, thanks to Christina's help, or if you prefer, we can listen to the 11 Q&As that are from the original audience. I do have a question for all of you. As you're listening, try to see what do canned pears, see if I can get that in there.
Focus.
Canned pears in their juice have to do with anything.
Laura's not here.
I know, I'm sorry. I have to unmirror my screen to make that work. Okay, so here we go. I'm going to share my screen. And I'm going to click the buttons this time for sharing sound and optimize for a video clip. And we're moving beyond the leakages, practical strategies to manage incontinence. This is the Family Caregiver Alliance website. And I am going to click. Christina, this is the right one to click, right?
It is, and then once you start play, there should be a button in the bottom right-hand corner to make it full screen.
Okay.
Hello, everyone. Thank you for joining Family Caregiver Alliance today for this caregiving information webinar, Moving Beyond the Leakages, Practical Strategies to Manage Incontinence.
Now, let me just check in. Can you all see it?
Yes.
Okay, you see it on the screen. Okay. Yay.
I'm Leah Eskenazi with Family Caregiver Alliance, and I will be your facilitator for today's webinar. Let me give you just a little background on Family Caregiver Alliance. For over 35 years, we've been working through the San Francisco Bay Area and across the nation to improve the well-being of family and friends who are providing long-term care. We offer support through educational classes, workshops, fact sheets, retreats, and caregiver support services, research, advocacy, and more. For more information, please visit us at www.caregiver.org. There are a couple of housekeeping tasks to address prior to beginning our session today. I'd like to point out that your phones will be muted for the entire presentation, which means that you can hear us, but of course we cannot hear you. So if you have a question, and we hope that you do, please type them in the GoToMeeting question box on your screen. So again, if you have a question, please type them into your GoToMeeting question box on your screen. You can do that at any time during the presentation. At the end of the presentation, Ms. Davis will respond to your questions. Concluding this presentation, you will receive an email asking you to complete a survey about this program, and please take a moment to share your thoughts. Your feedback, of course, is very important, and it helps us shape future educational programs. So I will introduce our speaker in just a moment, but first I would also like to thank our local area agencies on aging, including the counties of Alameda, Contra Costa, San Francisco, San Mateo, and Marin for their support in making this webinar happen. And now let's welcome our speaker, Nicole Davis. Nicole?
Thank you, Leah. Hello, everyone. As Leah mentioned, I'm Nicole Davis. I'm a board-certified adult and gerontological nurse practitioner. I'm also a doctoral student at Georgia State University and a Patricia Archibald pre-doctoral nursing scholar. So just to give you a little bit of background, I've been a nurse for over 14 years. I've been a nurse practitioner for over 9 years in a variety of settings, and I've had the wonderful opportunity to gain a great deal of experience and expertise in urinary incontinence, working at the VA in Atlanta with the geriatrics team there. I've also lectured and published on the topic. So I'm extremely excited to speak to you today because I'm very passionate about geriatrics, also passionate about helping family caregivers. As a caregiver myself, and also someone who's worked closely with caregivers as a clinician, I can truly understand the level of dedication and sacrifice that it takes for you to do all that you do. So I sincerely applaud you. The main purpose of my discussion is to offer you some insight into urinary incontinence in the hopes that it can benefit all of you in some way. Now, although some of you may have a great deal of experience with urinary incontinence, I realize that others may not. But irregardless of that, if all of you walk away today having learned something, I really feel that our time together would have been a success. So before we get started, I'd like to just take a moment and thank for their tireless efforts to help family caregivers and also for giving me this opportunity to speak with you today. Okay, so the burdens of incontinence. Urinary incontinence is an extremely burdensome condition, which I know really comes as no surprise to any of you. Not only is incontinence burdensome for the people who suffer with it, but it's also burdensome for those who care for them. Several studies have found that caring for someone with urinary incontinence significantly increases caregiver burden physically because of having to toilet them, financially because of having to purchase products, and also psychologically. Caregivers that I have worked with have simply said that they no longer have time for themselves and they're up all day and all night trying to manage the incontinence. So this, of course, is especially concerning because caregivers are crucial to the delivery of home care to our older adults. The services that you provide have been valued every year at more than $300 billion. So that's how much value you bring to the healthcare system. So because of this, it's important for us as a medical community to address your burden and address your needs and provide you with the education and the support that you need. And that's really why we're here today. So our goals are to discuss the practical tips in managing urinary incontinence. We'll talk a little bit about some strategies to promote safe toileting, reduce the risk of falls, and also skin care. And then at the end, we'll briefly discuss strategies to manage the stress related to caring for someone with incontinence. There are several different definitions of urinary incontinence, but it can be simply defined as being a leakage of urine that happens outside of a person's control. There are many potential causes of urinary incontinence, so what we'll do is just briefly cover and discuss ones that you may encounter. Abnormal changes in the urinary system. There are changes that happen to the bladder and also structures in the pelvis as people age that can play a role in the development of incontinence. However, what I really want you to understand is that urinary incontinence should never be considered a normal part of getting older. Just think of it as another medical condition. Loss of mental ability is another potential cause. With this, there's a loss of an ability to understand and recognize the urge to urinate, and we see this a lot with people who have dementia or some kind of cognitive impairment. Physical disability is another potential cause. This is when a person has difficulty physically getting to the bathroom, or perhaps if they have arthritis, there's a loss of dexterity in their fingers, and that makes it difficult for them to remove their clothing or to get to the bathroom in a timely manner. Uncontrolled or undiagnosed medical conditions, for example, uncontrolled diabetes or undiagnosed congestive heart failure, things of that nature can manifest themselves as urinary incontinence. Constipation, which is a common problem in older adults, but what happens with constipation, the rectum becomes distended and filled with stool, and that distension causes pressure on the bladder, and that causes irritation and urinary symptoms, and those symptoms can lead to urinary incontinence. And then lastly, side effects of medication. Common medications like diuretics for those who have congestive heart failure, there's certain blood pressure medications, and even common over-the-counter allergy medications can make people more susceptible to urinary incontinence. So let's talk about some of the common myths that surround incontinence. So the first myth is that incontinence is a normal part of getting older. And as we just discussed, the truth is it really is not an unavoidable part of aging. It is more common in older adults, but again, don't consider it just a normal part of the aging process. So another myth is that very few people have urinary incontinence. Well, the fact is, more than 200 million people throughout the world suffer with urinary incontinence, and 17 million of those people are within the United States alone. A third myth is that drinking less fluids will help with the leakages. The fact is, limiting fluids can lead to dehydration, and that can make your bladder conditions much worse, and we'll speak a little bit to that later as well. Another myth is that nothing can be done to help urinary incontinence, when the fact is urinary incontinence is actually a treatable condition. There are several different types of incontinence, and it's usually the type of incontinence that will guide the treatment. But irregardless of the type of incontinence in frail older adults, like the ones that you take care of, conservative treatments, which is what we're going to focus on today, are really considered ideal because they're low in risk. Other potential treatments of incontinence do include medications, and in some instances, surgery is an option. Another myth is that the person that I take care of, if they have urinary incontinence, that makes me a bad caregiver. And that's absolutely not true. Urinary incontinence in your care recipient really is not a direct reflection of your caregiving abilities. So I just want you to look at it in terms of, again, like I said, it's just another condition that requires your attention. Okay, so let's move on and talk a little bit about toileting and dementia. Because of the cognitive changes that happen as a result of dementia, sometimes those with the illness have less of an ability to understand and respond to the urge to urinate, and this is a type of what we call functional incontinence. Also with dementia, people are sometimes less able to understand what everyday objects are used for. So if this situation, applies to you or your loved one, I have here listed some suggestions that you can use. So firstly, you want to try to observe for toileting cues, or in other words, signs that can indicate to you that they may need to use the bathroom. Some of those signs can be restlessness or agitation. If you see them shifting in their seat or pulling on their clothes, all of those things may indicate non-verbally that they need to use the bathroom, so go ahead and try and toilet them. To help them identify the bathroom or the toilet as an appropriate place to urinate, you can paint the bathroom door or even the toilet seat cover a bright color, for example, red. It may also be helpful to remove common objects that can be mistaken for a toilet, for example, house plants or small trash cans that are around your house. And then finally, you always want to choose clothing that's easily removable, that will allow them to get to the bathroom quickly. Bathroom safety and falls. With toileting, you really want to promote independence, reduce the risk of any can occur fall, or any injury that can occur to you as you're helping them. The tools listed here will do just that in terms of creating an environment that promotes independence and reducing the risk of falls or fall-associated injuries. Probably one of the most difficult in a patient's home is trying to watch a caregiver maneuver in the bathroom trying to toilet their loved one. And the reality of it is many of these bathrooms just aren't built for those purposes. So if you install something like grab bars, if you have a raised toilet seat, and also a non-skid floor mat, any of those things can be very helpful to keep you safe and also keep your loved one safe from injury. So bathroom safety and falls, this should also be considered if your loved one gets up at night to urinate. So what you want to do if they do get up at night to urinate, you of course want to maintain a well-lighted path to the bathroom. Consider using a urinal or a bedside commode. You should also try to limit fluids before bedtime. The clinic setting, we sort of use a 2 to 3 hour time period as a rule of thumb. So you can start cutting back on fluids 2 to 3 hours before bedtime with the goal of eliminating all fluids within 1 hour of going to bed. And then have your loved one empty their bladder before bedtime. Assistive transfers. If this hasn't already happened, there eventually may come a time when you have to help the person that you care for either stand or transfer to help them to toilet. Therefore, using proper body mechanics, which really means correct body positioning, can help protect you from injury. And we always want to protect you so that you can do the wonderful things that you do. So helping with transfers doesn't always really relate to physical strength, as it's more associated with aligning your body to make movements as fluid and as easily as possible. The first thing you want to do, especially if you're dealing with someone who has dementia or some sort of cognitive impairment, you just want to approach them gently and always explain what you're going to do first. A lot of times people just don't understand the importance of just taking a moment just to explain, and it can save both people a lot of aggravation if you just you can toilet them without them understanding, become resistive. So again, just approach them gently and then explain what you're going to do first. If you're transferring from the wheelchair, you want to position the wheelchair as close to the toilet as you possibly can, and always be sure to lock it. People always seem to forget that part. You never lift the person up using your back. You always want to bend your knees. What you can try and do is place your arms under their armpits so that they have something to sort of a stable place to push off from, but you don't want to pull their arms away from their shoulders. Like you have a secure grip, you push up from your legs. Now, all this is always better if you can stand close to them as much as possible. Another option would be for you to bend your legs, have them wrap their arms around your neck as if they're giving you a hug, and then pull their body gently closer to you, and then stand up that way. Once you're already standing, you want to pivot and turn your whole body. Try not to twist just one part versus the other. You want to move your body as one full unit. And then always try to have a plan ahead of time, what exactly it is you're going to do, and then allow your loved one to always help if they can. And then finally, you know your limitations and know when you should ask for help. In terms of toileting in public settings, you can use these same strategies, but also take advantage of larger handicapped equipped stalls that of course have rear seats. They also have grab bars, so it makes the transferring that much easier. Another consideration that Leah Eskenazi had shared with me that she had heard from another caregiver states, like in the state of Oregon, there are actually stalls that have signs outside that are designated as unisex stalls so that caregivers of the opposite sex can toilet their loved ones. Now, not every state, of course, has this as an option, and with some other caregivers carry signs that they themselves stick outside of the stall toilet in their loved one. That way that decreases the anxiety for other people if they see someone of the opposite sex in that bathroom. So there's two strategies that you can use with your loved one to help improve their leakages. And the two things we're going to talk about are scheduled toileting and also prompted voiding.
Yeah.
With scheduled toileting, the goal here is to get ahead of the leakages. And some people refer to this as toileting by the clock. What you want to do is pick a time interval. As a rule of thumb, we use every 2 hours, but if that's not really reasonable for you, you can try to go up to 3 to 4 hours, but I wouldn't go past 3 or 4 hours because that's usually when a person will need to use the bathroom anyway. But you pick a toileting interval that works best for you. Again, we'll try every 2 hours. You want to start first thing in the morning, and you have your loved one empty the bladder. And from that point on, you're going to follow the clock, and every 2 hours you'll take them to the bathroom and you toilet them. The key with this is that they need to try to urinate even if they don't feel the need, because what you're trying to do is to urinate at a frequent, go to the bathroom at a set frequency, so that decreases the chance that there's extra urine in the bladder, and that decreases the chance that there will be leakages between the toileting time points. Be sure that they empty their bladder before they leave home and also before bedtime. And if it's sort of hard because some people have difficulty keeping an eye on the clock, you're so busy and you're doing other things, another strategy that some have suggested is toileting after meals. So you would toilet after breakfast, after dinner, and then before bed. And that should pretty much cover those time points. This strategy is primarily used during the daytime hours because preferentially you'll allow the person to sleep through the night, but it also can be done during the nighttime hours as well, and that's really up to you to decide. Similar to scheduled toileting is prompted voiding, but prompted voiding is different because what you're trying to do is to change your loved one's behavior by encouraging them to be dry, and you're also trying to promote independent toileting. So with prompted voiding, you'll approach them every 2 hours and you'll ask them, are you wet or are you dry? You check their incontinence pad, and if they are dry, you give them praise in the form of verbal interaction and verbal praise, and then you try to toilet them. If they're wet when you check them, you don't give them any praise or any interaction. You don't give them any positive feedback, but be sure that you don't give them any negative feedback either. And then again, you try to toilet them. When you're toileting them, you want to try and keep the bathroom environment as relaxed as possible. You want to promote privacy. Some have suggested running a faucet in the bathroom, but sometimes that can stimulate the urge to go. And you want to try to encourage them to toilet, even if they refuse. I'd offer it maybe 3 times, and if they still refuse, then you should just say to them, okay, well, I'll be back at the next time point. Like, for example, I'll be back in 2 hours, and we'll try then. If they actually do try, then you praise them for their efforts. So the praise for successful toileting isn't really praise if they actually urinate. Praise is for them trying to urinate. So believe it or not, prompted voiding can actually be used with people who have dementia. It usually works better in people who have earlier stages of dementia. But if you're thinking, well, whether or not this works for you, studies have told us that caregivers usually do a great job identifying whether or not their loved ones could use this approach. In the nursing home setting, Auslander and colleagues identified a technique that they used to see if a person would be appropriate for prompted voiding, and they would ask them to say their name, and then if they were able to identify one of two objects in the room, for example, a clock, and also physically if they were able to get around independently and need minimal assistance to get to the bathroom, then they knew that that person was a candidate for prompted voiding. So that's just one strategy that you could use if you think that this would be a good idea for you and your loved one. So in conclusion, both of these techniques require persistence and training because both you and your care recipient are learning something new. It may take some time for both of you to actually get used to this, but I would encourage you to not give up. Try it for at least 3 days and then see whether or not from that point, whether or not it's something you'd want to continue. Caffeine. So you may or may not already know this, but caffeine has been known to be a bladder irritant. It's also a mild diuretic. Lately, there's been some debate in the medical literature regarding the amount of caffeine that's consumed and the effects of caffeine on bladder symptoms. But what we know is that some people can be very sensitive to caffeine, even in small amounts. So oftentimes in the clinic setting, we encourage gradual elimination of caffeine. Now, the elimination should be gradual because caffeine is notorious for causing withdrawal headaches, which some of you may or may not be familiar with. So we encourage to switch to decaf, or you can have strength coffee. So your options would be to either your goal to be switched to decaf or decrease the amount of coffee that you drink or your loved one drinks, excuse me, and see if that makes any difference. Then also I just want to point out that even though there are decaffeinated drinks and beverages and those things are acceptable, it's not totally caffeine free. Fluid management. So with incontinence, many people erroneously restrict fluid intake thinking that it would improve the incontinence. So they think if they drink less, then they'll have less leakages, and that's really not the case. When you decrease the amount of fluids, oftentimes that results in underhydration, which increases the risk of bladder infections. It can also irritate the bladder lining. And in addition to that, not enough fluids or inadequate fluid intake can result in constipation, which, as we talked about, is a common contributor to urinary incontinence in older adults. So according to the most current recommendations from the Institute of Medicine, the amount of fluid intake that a person should have for women should be about 91 ounces a day, and that's beverages and food total, and then 125 ounces for men, which equals about 8 8-ounce glasses of fluid a day. So in a clinic setting, we usually target 6 to 8 8-ounce glasses of fluid as a recommendation, and there have been several urinary incontinence studies that have used this behavioral approach successfully. And then again, if nighttime urination is an issue for your loved one, you again want to try and stop drinking fluids or have them stop drinking fluids 2 to 3 hours before bedtime. Here are a list of common bladder irritants. I would suggest that you try to limit dietary exposure to any of these as much as possible. And if the person that you care for consumes a large amount of these or several items on this list, one approach would be to try and eliminate one at a time and see if that makes any difference. But we have listed here artificial sweeteners, spicy food, tomato-based food, citrus products, carbonated drinks, and also alcohol. As we discussed before, chronic constipation again can cause urinary symptoms which lead to incontinence. Now here are a list of several over-the-counter remedies, and although they can be helpful in the short term, for example for a few days, longer-term use of these things can cause significant problems, which are listed here. One effective approach is to increase the dietary intake of fiber. The current recommendations are that the normal amount of fiber that's needed in the U.S. diet is anywhere between 25 to 35 grams per day, and most people or adults within our country only get about half of that in. So one approach is to increase your dietary intake of fiber, because fiber will help promote evacuation of the stool. Here's a recipe that we call a constipation recipe in the clinic, but we've used it successfully and many patients have sworn by it. So what you want to do is take 1 cup of crushed 100% bran flakes. You can also use Fiber One cereal. You want to mix that with 1.5 cups of canned pears and real juice. For whatever reason, it's very important that it's in real juice. It doesn't seem to work as effectively if it's in some type of a syrup. You blend it together until it's a mushy consistency, and then you store it in the refrigerator, and it should keep for about a week. Then every morning you have your loved one take 1 tablespoonful and you drink a cup of a warm beverage of their choice, and then hopefully you give it at least a week, and then you can increase by another tablespoonful, and don't go over 4 tablespoonfuls, but you increase it as needed until you get the effect that you need. The most important thing here is to be sure that you drink enough fluids. I can't stress that enough. Fiber can almost be like cement in your gut, and that if you don't have enough fluid to mix with it, it can have the counter effect and cause constipation. So be sure that they're getting in the right amount of fluids. Skincare. So because of moisture, urinary incontinence is a common cause of skin damage. And if left untreated, skin damage can lead to infection and pressure sores. However, with proper skin care, these things can be prevented. The goal here is to maintain the health of the epidermis, which is the top layer of the skin, and you want to limit the exposure to irritants. So to keep the epidermis of your care recipients healthy, you want to use gentle techniques when you're cleaning them. Avoid rubbing and scrubbing or using harsh chemicals or soaps. Some other strategies that you can use are to apply a moisturizer to restore the lipids to the skin, and then use a moisture barrier to protect the skin from irritants. And examples of those are lanolin, petroleum, zinc oxide. The key here is to develop and maintain a daily routine for skin care. And then finally, if you do notice any skin changes, any new skin breakdown, you really should alert the healthcare provider of your care recipient as soon as possible so they can take a look at it and treat it in a timely fashion. Urinary incontinence product selection. So I'm sure, not surprising to you, there are hundreds of products on the market today. Generally speaking, when you're selecting products, here are a few rules that could guide your selection. Firstly, size. Be sure that the size and the fit are correct. Obviously, if the size isn't correct, if it's too big or even too small, there's a chance that there can be leakage around it and it can be ineffective. You want to pick the product that contains the amount of leakage that your care recipient suffers with the best. And if you notice that you're using a lot of products on a daily basis, maybe that could be an indication that you should look for a product that can contain a larger amount of urine so that you're using less of them. The time of day is also important. For example, nighttime leaks requires consideration, like bed pads, sometimes mattress covers to protect the mattress and the bedding, things like that. For some people, they leak more or less during certain times during the day. As I'm sure you have noticed, that guides the products that you select as well. Also, urine versus stool. There are some products that work better in controlling urine, stool, or both. I know a lot of times with older adults, especially frail older adults, they not only have urinary incontinence, but they have fecal incontinence as well. So I'd encourage you to read the packaging, the label packaging, to get some guidance about what product works best for urine, stool, or both. And then gender. Gender is always a consideration. There are certain products that are designed to capture leakages in relation to the male or female anatomy. So just be mindful of those things. So urinary incontinence product cost. Although we know that these products are extremely helpful, unfortunately cost is a major problem. Generally speaking, Medicare and private insurers do not cover the cost of incontinence products. However, if incontinence is listed as a medical diagnosis and products are ordered by a healthcare provider, they may be covered. So I would encourage you to talk with insurers for your care recipient to see if this situation could apply to you. Also, if your care recipient is entitled to VA benefits, the VA does cover the cost of incontinence supplies, which is something many people don't realize. Medicaid may cover some situations. Again, I'd encourage you to contact your local agencies for more information. But one approach, which seems to be one of the most cost-effective ways to get products, is to order bulk by bulk online. And you want to try to look for hospital grade because those are usually of better quality. That's usually the most cost-effective way that you can get those products. And then also grants. There are grants which may be available to you, which we'll discuss in the next slide. So who to contact? Here are a few suggestions. You can contact your local area agency on aging, also local Medicare, Medicaid agencies, and social services. All of these places may have grants that you're eligible for to help you with the cost of supplies. And in preparing for today, I contacted a local agency, local Medicare agency where I lived, and discovered that they have a designated program for family caregiver called Family Caregiver Supplemental Support Program, and that's in South Carolina. And it is a grant. You go through an application process, but if selected, you get $550 a year for urinary incontinence supplies. And that's just me calling just with one phone call. So again, the take-home message here is to have you call around, be diligent, ask questions, and then no matter what you learn, it's important for you to share what you find and what you learn with others. So managing the stress related to urinary incontinence. As we know, urinary incontinence can be extremely stressful for you. To help with the stress, I think one of the first things is for you to be realistic and realize there are good days and bad days. And if you anticipate the bad days, hopefully they don't overwhelm you as much. With incontinence, it's the kind of illness where if things get better, sometimes the improvements may be very, very small. So it's important for you not to get discouraged. You know, give approaches and strategies time, and then sometimes when you look back over a certain period of time, you realize how much progress and how far they've come. I'd also encourage you to take care of yourselves. Take a few minutes each day if you can to really calm yourself, calm your mind, and center yourself, because the more you take care of yourself and the better you are in terms of taking care of yourself, is the better you are or will be able to take care of your loved one. And then finally, don't be afraid to ask for help. There are many online resources available for you, but what I have listed here is probably one of the best and most comprehensive sites that I have found. It's the National Association for Continence, and we sometimes refer to that as NAFC. You have the website at the bottom of. They have additional information, more details on how to choose products, how to provide skin care. If managing odor is a problem for you, they have information about that. And they even have information about finding medical specialists within your area. So I'd encourage you, if you have any additional questions or you need some follow-up information, that's really a wonderful resource for you. So we've come to the end of our discussion today, but in closing, I just wanted to share with you one of my favorite quotes about caregiving, because I really think that it encompasses all that you do. You give little when you give of your possessions. It is when you give of yourself that you truly give.
Okay, that's a good place to stop and see if there are some questions that you have, or if we should go just continue on. There are 11 questions that the original viewers asked, and some of them are quite interesting. So everybody, could you turn your mics back on and or put them in the chat and see what do you think?
And Laura, you did ask the question about local grants for supplies for urinary incontinence. So I'll bring that up. The program that was mentioned in the webinar is the National Family Caregiver Support Program. So it is a federal program. Every state has it. Every county has it. Exactly what is funded under that varies county by county. So it is a specific kind of supplemental funding program. So Family Caregiver Alliance is one of the contractors for the National Family Caregiver Support Program in San Francisco, Alameda, Contra Costa, San Mateo. In 2 of those counties, there is this supplemental funding that is available that does allow us sometimes to purchase funds for incontinence supplies, assistive devices, home safety devices, home safety modifications for caregivers, but it really varies county by county. And it is under the caregiver support program. So for somebody who is not a caregiver or does not have a caregiver, but is still looking for help with incontinence supplies, unfortunately, they would not be eligible for that program.
Bummer.
Yeah, it's incontinence supplies they're so expensive. They're needed constantly. And there's not a lot of coverage. Again, VA will cover it. Medi-Cal, if you are on Medi-Cal, which is for California is the Medicaid program, will often cover incontinence supplies kind of with a doctor's prescription and order. Usually limits how much per month, but can cover it. I think we are seeing the potential, though, that Medicare Advantage plans will start to cover it. If you have straight Medicare, straight fee-for-service Medicare, you don't have, say, Kaiser Senior Advantage or HealthNet or some other what they call kind of Medicare Part C, which is your Medicare Advantage plans. If you have straight Medicare, not going to be covered. Medicare Advantage plans are starting to provide or at least have the opportunity to provide coverage for additional types of needs that have not historically been covered under traditional Medicare. Incontinence supplies can be one of them, things like transportation, help with meals, more ongoing in-home care, but it really varies by your particular Medicare Advantage plan. So there's not consistency at all across the board. So if there's something, incontinence supplies or other needs that you have that you're like, it's related to my health, shouldn't that be covered? It's worth reaching out if you have a Medicare Advantage plan to your plan, because we are starting to see them cover additional things like this, because really at the end of the day, it helps people take care of their health better, which should lower costs for the health insurance. So that's where we're seeing some of them start to do it, but there's no one place that you can look up and see which Advantage plans cover that. And because the Advantage plans vary kind of region to region, it's
all over
the place. You really have to call and ask.
Well, and who knows, maybe one of these new legislative packages that is supposed to do infrastructure that includes healthcare will have something to do with that. I would love to see that added, because it's wonderful to have something that isn't a chemical change for to help with incontinence. Any other questions?
Yeah, Laura, I had one for Christina. I was interested when Nicole was talking about the physical aspects of helping someone, lifting them onto the toilet or whatever. Is that material available somewhere in terms of, specific instructions? I mean, she kind of gave us a nice overview of what to do, but I just wondered if there are resources that kind of give more detail on how to do that.
There are. So Family Caregiver Alliance actually has, it was on DVD and then also is on our website and on our YouTube called Caregiver College, where we actually do show demonstrations of helping to transfer somebody from a bed into a chair, into a shower. So I'll look it up and I'll stick ours in the chat. We also have on our website, and you can find it elsewhere, there's a group called the Home Alone Alliance, which we're a part of AARP, the VA, UC Davis, and also does kind of skills-based training for caregivers, including things like transfer skills. The other option, because again, these are going to be general, these are typical tips on how you can provide this type of care. So they're helpful, but it is a general tip. It is also possible to always ask the doctor for a authorization to have a physical therapist come out and do transfer skills training. And that can be covered by insurance when the doctors approve it. So again, these can be good, helpful tips. It can also be helpful to get that physical therapist to come out and do that one-on-one training, because that's going to be then specific to the person who's needing help and specific to that caregiver who's helping them to make sure that you're really doing it based on their needs.
Could I ask, so that's a DVD, so it actually shows people being transferred, so you could actually see where the hands go? And
it does. Like I said, it started as a DVD. It is also on our website. I will look up the link for it and share it in the chat.
Steve, one of the questions that's asked, and you can go ahead and watch the rest of it, anytime, because it's on the Family Caregiver Alliance website. They ask, isn't there something that we could give other people? And they say, yeah, there's a booklet to share, excuse me, at nafc.org. But again, Christina has says that hers is general, but having a DVD that explains things can make all the difference when you're trying to explain to someone how, whether it's the one who's going to be moved or the people who are supposed to do the moving to see it.
Great. Yeah. Thank you, Christina.
Sure. So I shared initially just the transfer skills one. I'm going to put the link to the whole Caregiver College video series that has a number of the different clips in it as well.
Thank you.
So
Caregiver.org resource. Okay. Any other questions or experiences you want to ask about? Rena, did you know that your hand is raised on your picture? Do you have a question?
Nope.
Okay.
I raised my hand, but not for that purpose. How do I get it off?
Go under the little menu at the bottom that says reactions.
I don't have one.
Oh dear. And it's got a raised hand that it will fade out. How intriguing. You don't have one.
I have a hand at the bottom of the page, but I don't have a reactions.
Oh, maybe you could click on the hand, see what happens.
I just did. It disappeared, but the one up there. How about clicking on it on the, no, that doesn't do it.
No. Christina, any?
I mean, you're on a tablet. Laura, do you have the host function?
Oh, I'm sorry. No, Bill does.
Okay, Bill, you should be able to lower her hand. If you go to the participant list, you have the option to. You have the control to lower people's raised hands. There you go.
I just did it.
Oh, you did it. Okay, great.
I went to the participants and did it on the participants list.
Oh, okay.
Okay.
Great.
All right. Well, thank you so much, Christina. Oh,
650-374-1700.
sorry. Thank you, Christina, for having this wonderful resource that could answer our questions and help us out with a topic that is not always addressed, and certainly not as easily as this.
Absolutely. And, there's so many medical conditions, so many medications that can cause issues with incontinence or constipation. And so it's not something people always talk about. It's always a good thing to bring up to the doctor, because there are sometimes things that they can do, or they can look at certain medications, what's helpful, what's not. But it's a helpful one to bring up and to raise if you if it's something that's an issue or a challenge for you or for somebody else in your life, because it is fairly common across different medical conditions, and again, often related to medications or treatments as well. And those may be necessary. It's just a side effect that often will come with it.
Oh, Rena, your hand's up again.
I know, I just put it up. I had a question. I'm trying to get back in. I'm not in the.
Well, we can hear you. You could go ahead
Okay,
and
I could
ask.
just do. There are people such as myself who have heart failure,
Mhm.
limited liquid intake, Lasix.
Mhm.
Is there anything in that range that can deal with the incontinence?
Again, that's, I'd say, a question really to bring up with your doctor, because when people are needing Lasix, when there are issues with water retention and trying to, monitor how much somebody is drinking, it is that very fine line then to not wanting to be consuming too much fluid that it causes other health issues, but not taking too little in where it starts to cause dehydration. And again, that can lead to constipation. And this is unfortunately what we see a lot of times with medications. You're on one medication for a particular health condition, then they need to give you another medication to deal with the side effects from that first medication. And so it's looking at, are there other things? And that's where, Nicole Davis in the webinar talks about her, that constipation, what did she call it? Basically the concoction, the pears and the bran flakes, as a way to deal with constipation that then is not just related to laxatives or other things that help deal with that. So this is really a conversation to have in detail with your doctor.
I'm so glad you said that. And in fact, Rena, I might also recommend the open forum on Mended Hearts. The first advice, like I said to Mary Harper, the first advice they're going to give you is you should ask a doctor, but then they can talk about just their experience. And so you might, knowing that it might not be the same for you, you can put a question like that up on this forum. So would you like me to send you the same forum information that I'm going to send to Mary Harper?
Yes, please.
Okay. Because I found it a very useful place. I mean, who knew you could ask questions like this and pull on other people's experience, but without having, them say, wait, I'm not a doctor, so you can't listen. You can just relate your experience.
And I will say sometimes there are some doctors that are better than others at really having these conversations. I mean, this is true across the board, but definitely about incontinence and medications. If there is a nurse or a nurse practitioner that you're working with, I have to say they often go a little deeper with some of these conversations than we sometimes see doctors do. So, those are great people to ask the questions, whether it needs to be a referral to a urologist, that sometimes is necessary. But, it's okay to push back a little bit if you feel like you get a response from the doctor of, oh, well, yeah, that just happens. That's necessary. Like, is it, or is there something else that would be helpful? And it's okay to ask for a second opinion or ask for a little bit more information about it. Or ask if there's an alternative. If there's certain medications that are really problematic, to see, is there something else that would work better? And the answer might be no. And then you might try some of the tips that Nicole Davis brought up in terms of timing or in terms of products. You know, those might be the option instead.
Okay. Thank
Thank
you,
you.
Christina. I'm being mindful of our time, especially for this wonderful recording that we can have to have other people look at. Thank you all for coming and being part of this wonderful chance to find out what can be done about the myths that keep this going. And thank you. Bill or Susan, any other things before we close out?
No, I thank you very, very much. There was an excellent program, very informative. Thank you, Chris.
Yes,
Yeah.
yes, thank you.
Okay. Rena, your
Yeah.
hand's up again.
Yeah, are you
Yeah.
gonna send me an email?
I am.
Okay,
I think I already have your email address.
you should, yeah. And that formula that was on with the pear juice,
Uh-huh.
I'd like that because I couldn't get it down fast enough.
Okay. I will be glad because I'm trying that. I'm going to see how it works.
Mhm.
I went to my store and I got some pear juice that is which you can't see, but it's there. With its juice, and I got some bran flakes, so I'm going to give it a shot.
There is also, Laura, if you want to share it, if you guys share the recording, a link to the PowerPoint on the website underneath the recording. So you can always just download a copy of the PowerPoint as well. And that obviously will have all the information, but that way you don't have to pause or try and write something down
Oh, good.
as the screens are going by.
There, Farina, yes, I'll send you the PowerPoint where you can look at it to your heart's content. That'll be great.
Okay, thank you.